subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors Today. We are delighted to have here with us a very senior doctor, a very senior dermatologist who is Professor Dr. Rajesh Kumar with us today. He is, as I mentioned, a senior dermatologist. He is a professor of dermatology at the Grant Medical College in Mumbai. He's also honorary dermatologist at the Tata Memorial Cancer Hospital, a senior consultant dermatologist at the PD Hinduja Hospital, the Breach Candy Hospital, and the Bombay Hospital, where he is connected with us today. He is honorary dermatologist to the governor of Maharashtra as well as the police force. Thank you, Dr. Rajesh Kumar, for being here and sparing your valuable time.
Yeah, it's my pleasure. Pradyum.
Today the topic that we requested Dr. Rajesh Kumar to speak about is common skin and foot concerns in seniors, and specifically beyond wrinkles, dryness, and itchy skins. Things that are of normal concern to seniors. We said let's look at what are the common skin and foot concerns in seniors, and that's what we requested Dr. Rajesh Kumar to speak with us. And as always, Dr. Kumar will make a presentation. And those of you who have questions, please put them in the chat window, and I will address it to Dr. Rajesh Kumar after that. Please ensure that you do not talk about specific medicines, etc., because we may not be able to address that. Do remember that this session is advisory in nature. There's nothing like a clinical examination, examination by a doctor. Of course, doctors like Dr. Rajesh Kumar are also available for a teleconsult through the various hospitals that he's attached to, so you can do that. But and also, just like always, this video will be edited and put up on the Seniors Today website on Monday. So don't worry about taking notes, etc. You will be able to see the presentation, and you will be able to see all the answers that he gives once again. Over to you, Dr. Rajesh Kumar.
Thank you very much, Mr. Maheshwari. Good evening, each and everyone. So the topic is already been explained by Mr. Maheshwari. So what happened to skin in old age? So it's become thin because the outer layer, there is a thinning of the skin. The outer layer of the skin thins, making the skin look paler and more transparent. There is a loss of elasticity to the skin, and there is a dryness, which we are not going to discuss it today. There are age spots, flat and brown spots that appear on the sun exposure. The blood vessels in the skin become more fragile with age, making it easier to bruise, increased risk of skin cancers in old age. So that's what we are going to discuss it today. This is how you can see the skin is look like. The whole skin become shriveled or thinned out. The epidermis, dermis, and subcutis, which we call it technically, become thinner and thinner with the age. See how the skin look like. They are wrinkled, transparent, and paper-like, cigarette paper-like. This is how it looks like on face. You can see the fine wrinkles and coarse wrinkles. So how to prevent it? Use the sunscreen and protective clothing. Eat a balanced diet and drink enough water. Use moisturizer. And nowadays there are many over-the-counter products available which are formulated for aging skin. Use retinol creams, but you should look for a appropriate percentage of retinol so that it should not irritate your skin, and you should only apply on the face or an area which is cosmetically important to you. There are a lot of over-the-counter anti-aging skincare products available. You can try it out. And this is age spot, how it looks like. It's a basically hyperpigmented macule. You can see on the cheek few more pictures of age spots. This is over the dorsum of the hand also. Some are elevated. So we technically call it seborrheic keratosis, and age spots are same. Yes, they are same. And they are also called liver spots or wisdom spots. They are non-cancerous skin growths. So nothing to worry about. But if you feel that is cosmetically not acceptable, then you can go for its removal. This is how the seborrheic keratosis look like. The more closer picture. How you prevent it? Wear sunscreen of broad spectrum. In Indian skin, SPF 30 or higher. I recommend 50 and higher. Wear protective clothing such as long sleeve clothes like shirts, pant, and wide brim hat, and avoid excessive sun exposure because it is not good for aging skin. Treatments are available like a retinol. We have now laser therapy, different type of chemical peels, and sometime when there is a growth, we can use cryotherapy. When to seek medical advice? If you have any new or unusual spots, if you have a spots or sores that are small, shiny or waxy, scaly and rough, firm and red, crusting or bleeding. Now coming to the bruising. This is a very common occurrence during the old age because of the thinning of your vessels, which ruptures easily due to even a trivial trauma. Even rubbing of the skin, you rupture your superficial vessels. So blood come out and accumulate under the superficial skin, and that's how it look like. It's scary but harmless. Another picture. This we call it as a senile purpura. So no treatment is required. These are more common when a patient is on blood thinner. These are the different type of skin cancers we normally get in Indian skin. Non-melanoma skin cancer, which is basal cell carcinoma, and rarely squamous cell carcinoma. This is how the basal cell carcinoma look like. So if there is any growth, especially you should not wait. You must consult the dermatologist or treating surgeon. Sometimes the lesions look like a ringworm. When it is not, then you should try. Sometimes it may turn out to be a superficial basal cell carcinoma. This is how the another basal cell carcinoma near nose. The treatment of choice for basal cell carcinoma is surgical excision. But these basal cell carcinoma, let me tell you, are non-aggressive tumor. It's locally invasive. So it's not going to spread to other part of the body or involve the other organs. So you can get it removed and it's harmless. When you feel that it's aggressive, or as I shown in picture, it's look like cauliflower growth, then you may think of something else. It may be turn out to be a squamous cell carcinoma, which is a malignant non-melanoma cancers on Indian skin, which is very, very rare. But in this case, we excise it out with a margin and look for the spread by doing PET scan. Now coming to infections. These infections are nowadays very common, widespread fungal infection. I'll show you some of the photographs. You can see the extensive involvement of the crural area, groin or side of the thigh. If you can notice, there are a lot of small nodules within the ring lesions. That could be because of topical steroid application. So you should avoid topical steroid application and apply only antifungal agents. Otherwise, the lesion is going to be there for a longer period of time, or sometime it may not respond to an antifungal agent. Another picture where you can see the extensive involvement, inframammary region. There are a lot of mimickers also. Sometimes what we feel is a fungal infection of side of your thigh, but it's turned out to be a scrotal lichen simplex chronicus. Similarly, in case of female, it's a vulval lichen simplex chronicus. Many times, especially in diabetic, you may notice this kind of lesion. These are nothing but tinea pedis, which is involving the toe web space. Along with web space, there is an involvement of, I appreciate, there is a greenish yellow discoloration of the nail, which is quite suggestive of fungal infection, which we medically call it as a onychomycosis. Another photographs. So together we call it as a tinea corporis, or fungal infection of the body parts. There are a lot of creams available in the market that it is advisable you must consult a dermatologist or your primary care physician before applying any over-the-counter drugs. Sometimes what happens, if you are not applying an adequate percentage of topical agent, then your fungal infection may be resistant to fungal resistance to antifungal agents, and then it will become a lengthy procedure. Many a times when there is an involvement of more than 20% body surface area, then we give oral antifungal agent like itraconazole or terbinafine. But this medication should be taken on advice of a registered medical practitioner, especially dermatologist. These are the precautions you should take if you are diagnosed with fungal infection. Wash the affected area daily or dry thoroughly. Change your underwear or socks daily, especially if they become damp or soiled. Wear loose fitting clothing, preferably made of cotton. Avoid sharing towels, washcloth sheets, combs, or personal hygiene item. This is another problem which we encounter in old age, that is calluses, which is because of ill-fitted shoes and uh, repeated friction. And what happens when you wear a shoes which is not appropriate size, then you may develop it easily. The treatment for this condition is to use an appropriate wide mouth shoes. Along with these lesions should be paired off by either podiatrist or by a dermatologist. See how we are pairing the calluses on the sole. So proper footwear is very important when you deal with calluses on your foot. I think we have all the common topics which is there in old age. So thank you very much for your patience listening.
Thank you very much, Doctor. Thank you very much for
I
a
think
very.
I'm on time. I'm on time, Mr.
You're
Maheshwari.
absolutely on time. Thank you. Doctor, we've got quite a few, some questions already.
Yeah,
This,
tell me.
the first one is from Mr. Bharat Mehta, who's 67. He says, I'm having a skin problem in summer season and have to use cream. What precautions can senior citizens take in the summer?
Summer, they should take bath at least once or if possible twice, but they should apply moisturizer immediately taking bath so that they can retain the moisture. So there are a lot of moisturizing cream available in the market.
Um, Doctor, there are quite, as you
Good
mentioned,
moisturizing cream are available.
yeah, there are,
So as you said, I can't tell you brand name. I'm not supposed to tell the brand name of the product.
but still, for instance, I have this,
But there are a lot of,
as it happens, I have this,
let me tell you, let me tell you.
yeah, go ahead. Sorry. Go ahead,
So
doctor.
you want to tell you want me to tell the name of the products? Three,
To
four
get an idea,
products.
because there are these intense moisturizers. There are moisturizers which start from a very low amount to something like 1,200 rupees. Just to give you an example, there's a moisturizer called Cetaphil, which is 1,200 rupees. I have
Yes.
a moisturizer in front of me, which is white soft paraffin and light liquid paraffin lotion, which costs some 540 rupees. So
I
which,
think white soft paraffin, light liquid paraffin is good.
all right.
In fact, nowadays there are ceramide containing moisturizers. They mention it on that it's containing 2 or 3 ceramides, which is also a good moisturizer, which seals your moistures.
All right.
So it will not get evaporated.
Great. Doctor, there's a question from Shamala Ravi. Seniors end up using polypharmacy due to different health conditions leading to drug interactions and dry skin and irritations. From the skin point of view, I guess it's a good question. How does one handle polypharmacy?
I have seen many times the senior citizens are coming to me and taking a lot of medications prescribed by different specialty. So I tell them to go to a physician, MD medicine, and tell them to cut short the list of the medications because there are a lot of repetitions, 3, 4 vitamins are there or few medications which are not really required. So you can cut down the polypharmacy. So sort out what is important, what is less important. So important you take, less important you ask your physician, is it possible not to take these medications or it can be substituted by a food or food habits.
Right. That's a good suggestion.
And secondly, about the dry condition we have already discussed ceramide containing moisturizers.
Right. Question from Rosa Kurela says, is hardness of toenails a reason of concern?
Yes, that we call it as a trumpet nail. The nails are very thick, and when you wear a shoes and presses it, then you feel pain. We call
Right.
it the trumpet nail or callosity of the nail. Nail plate become thickened. So the only solution is to go to podiatrist or to go to dermatologist. They will cut it off. There is no medication to reduce the thickness of the nail plate.
Yeah,
Nail
because the
plate.
normal pedicure, when you go for a pedicure to a salon, etc., they are not able to really handle a thick nail.
I, I said Mr. Maheshwari, podiatrist.
That's right. That's right.
It's a different specialty altogether. It's coming in a big way. In
Yeah.
Europe, it's well known. Podiatrist.
Right.
Those people who deal with your foot.
Right. And
Podiatrist.
do we have just as an example?
There
Do
is
we
no
have
medication to apply for hardness. There is no medication. There is no medication. There is no medication apply for hardness of the toenail.
And do we have podiatrists in enough number in a city like Mumbai, for instance?
No. Currently, no. Very few, especially few in Bandras and few in South Bombay. Only few. Not well qualified podiatrists because we have no qualification for podiatrists in India.
And if this isn't a problem, if this is a situation in a city like Mumbai, you can imagine what it is in the rest of the country.
Yes. So I tell them not to wear tight shoes or shoes. Wear sandal. If you are wearing sandal, there is no problem. But when you wear shoes, then when shoes presses, there is going to be your nerve beneath the nail plate get pressed, and so that you will feel pain. Otherwise, there is no seriousness is hardness of the toenail. Cosmetically, yes.
Right. Doctor,
May not be acceptable to many people.
yeah, there's a question which has come in from Asha Jamkar, who asks, can you suggest some measures for shaft feet?
Chafe, you can apply Vaseline. Sometimes you can apply 10% glycolic acid with 10% urea. There are a lot of creams available in the market with a different brand name.
Right.
And that you can apply twice a day. And before applying, you must moist your feet by putting it into the lukewarm water for 10 to 15 minutes.
Right.
Not necessarily, some people put salt also. It's not required.
Right. Thank you. Doctor, we have a question from Saroj Vasa who asks, what is the treatment for degenerative dermatitis? These creams cause a lot of sweating, he says.
These creams never causes sweating. It's ointment which causes sweating. So there is a difference between cream and ointment.
All
And
right.
this is not degenerative dermatitis. I think it is something else. There is nothing like a degenerative dermatitis. So for dermatitis, you can apply topical steroid or emollient, any emollient. Best one is Vaseline, petrol jelly.
Thank you. Doctor, we have a question from Lakshmi Kumar Vavilala. One of my toenails is discolored and thickened and D-shaped. What could be the cause and what's the remedy?
It could be, as I shown into the PPT, it could be fungal infection of the toenail.
Okay, so I think that's the PowerPoint had it. There's a question from BNUV. I have recently developed melasma and I'm diabetic. What could be the reason and cure? I tried many creams by dermats, but hardly an avail. Treatment is expensive and all the creams are very, very expensive.
See, the cause of melasma is not known, especially develop after menopause and in some people after pregnancy. The cause exactly cause, the hormonal cause is not known, so we can't remove the cause. So we give some creams which demelanize. So as long as you are applying the cream or you are in maintenance cream, the melasma will go. Otherwise, it come back again. So it's a frustrating condition. I agree with Madam Ji.
Right. We have a question from Sunita Verma who says, why is it in the summer I develop blisters like acne around my lips?
Acne around the lips, I think it's not acne around the lips. It must be some blister. It could be herpes also. So we have to rule it out, what exactly it is. Because in old age, developing acne lesions around the lip is rarest of rare. I have not seen in my practice. Around the eye, yes. Around the eye, we see the open comedones, but around the lip, no. So
Doctor, we
could
have a
be
question.
viral infection.
Right. We have a question from BNOB again. I'm allergic to sunscreen. Any alternative? In fact, I'm going to ask another question. What is the truth about sunscreen? I was reading somewhere that sunscreens could well be harmful. Um, so, what is the truth about sunscreens, and what should one do?
The chemical, the efficacy and safety of the chemical sunscreen is not established, but this the well tried. So once a sunscreen suits your skin, you should not change it, and you should know how to apply it. It should be thick, and it should be applied 10 to 20 minutes before going out. If you are indoor, you need not to apply sunscreen on your face if you are indoor.
Right. Um, there's a question from Vijay Ganduri who says, despite maintaining good hygiene, itchiness in the back bothers seniors. What is the reason and remedy for it?
Can you repeat the question again?
Yeah, despite maintaining good hygiene, itchiness in the back bothers seniors. What is the reason and remedy for it?
It's a dryness. So you have to apply moisturizers. Many times what happens, if especially in old age, even in young age also, it's difficult to apply moisturizer on your back. You have to take a help of someone else. So skins are getting dry up, and that's why she is getting itching.
Right. The question, yeah, I guess that's the solution. We have a question from Anil Singh who says, is there any permanent solution for seborrheic
It's
dermatitis?
not seborrheic dermatitis, it's a seborrheic dermatitis.
Seborrheic dermatitis.
Unfortunately, it is less common in old age. So
Right.
there is no permanent solution, but this you can prevent it by taking adequate sleep, because seborrheic dermatitis precipitated by your hormones, haywire hormones. Sometimes hormones goes up. It stimulates your sebaceous gland to secrete more sebum, and that's how you develop seborrheic dermatitis.
Right. There's a question about from Shobha Srivastava. Doctor, I feel itchy in my lower legs. Uh, should I consult a dermatologist for that?
Lower leg, lower leg itching, if it is diffusely in both the lower leg, then most probably it is because of the dryness, because your legs get exposed to air more frequently than the other part of the body, and many a times it is not covered with the cloth. So lower part of the leg get exposed to more air, so it's getting more dried up. So apply moisturizer as frequently as possible.
Right. We have a question from uh, Hina Mehta, who asks, fingertips पर small cut हो जाते हैं, कैसे क्योर होगा?
हाँ, this we call it as a fingertip पे small cut हो जाते. This we call housewife dermatitis. The people who are more in kitchen and handling detergents. So there is a dryness and small cuts. So you can apply frequently moisturizer, especially petroleum jelly. So whenever you wash your hand, after that you apply Vaseline.
So, Doctor, this is something that we did, some of us who did not have a full-time house help, and we were forced to do a lot of our, day-to-day shows in the lockdown. We would apply our cream after doing the, utensils or sweeping, swapping, or whatever. So, you mentioned about petroleum jelly. What is the kind of basic, uh, ointment? Petroleum jelly which comes as, which looks green or pink in color or whatever in a bottle, is that what you're talking about?
It's white in color.
White in color, okay.
The commonest brand name is Vaseline.
Vaseline, okay. Vaseline,
That is a brand name.
all right. um,
Which are now more like a generic.
what about aloe vera, doctor? Is there something that you would advise, getting aloe vera and applying that? Shobha Srivastava has asked this question.
I'm not expert in aloe vera because it's Ayurvedic product, so I can't comment on this. Only thing what I know is a moisturizer.
All right.
Moisturizer derived from plants.
Right. But a lot of people do apply natural creams, etc. And is that something that you recommend at all, or you would only not be able to recommend talk about them?
Which cream, sir?
Natural creams, which are available in the market, from
See,
from
natural creams, if it is coming from a good company, those who have a research lab, those who tried on clinical trial and found out that it's okay, then you can use it. Otherwise, my on that is you should not keep trying Ayurvedic product without knowing it, because many a times it is the Ayurvedic products containing intense perfume and colors, which otherwise may produce allergic contact dermatitis or irritant contact dermatitis. I frequently see many people apply turmeric or haldi containing creams on their wound, and the wound get irritated, and then the healing time get prolonged. So you should not use left and right with a notion that all Ayurvedic products are safe and not going to cause any harm.
right. Doctor, one more question we have from Lakshmi Kumar Valewala, who says, I have a burning sensation in my feet. What should I do?
So I would like to ask Madam if she is diabetic, so that may be the early sign of peripheral neuropathy. Even in
Right.
old age also people develop peripheral neuropathy because of aging. But if she is diabetic, chances of getting peripheral neuropathy is very high. So there are treatment, but which I'm not going to tell you because it's a domain of dermatologist or physician.
Right, doctor. There are a few other questions. Doctor, there's one question which has come in, which is not exactly of a senior citizen, but since we have 5 minutes, my grandson, 14-year-old, is suffering from dandruff, especially in winters. Alternate days he does shampoo with his scalp, but not much useful. This is a question from Shilpi Biswas,
Mhm.
who's our regular either, but this is for somebody who's 14. Would you be able to advise?
I would advise that he should take enough sleep. I'm sure that his grandson is sleeping after 12 p.m. in night and getting not enough sleep. That's why the hormone levels are up, and that's how he is getting more sebum secretion on the scalp and a severe form of dandruff, which we medically call it as a seborrheic dermatitis. Technically, the technical term for dandruff is seborrheic dermatitis. So he
Right.
should take enough sleep and avoid gluten-containing food like wheat, you know, milk and milk product, and carbs.
So that doesn't leave too much of an option. Millets, etc., is something that people can have. Great. Thank you very much, doctor, for your time today. I know we've taken a fair amount of your
Thank you,
time on
sir.
a Friday.
Thank you.
Thank you, and thank you to to Bombay Hospital and to various hospitals who have facilitated this. As always, we will be back once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. The edited video of this session will be up on the Seniors Today website on Monday evening with the takeaways written by a qualified medical practitioner. So you can go through that as well as look at all our archives of Seniors Today webinars. The new Seniors Today issue is out. You saw a preview of it last week. We have a special issue on a few stories on the American President Donald Trump and his various ways. So you can have a look at it. Also, there is Evergreen Club, which is full of activities. There is seniors have talent and a host of things that are there. Please do log in and download the app and enjoy our various offerings. Thank you once again, Dr. Rajesh Kumar, for being here.
In fact, I would like to say that you are doing a fantastic job, especially for citizens.
Thank you
This
very
is a
much.
very nice forum. Keep continuing. I have all the best for your this motive
Thank you very much.
and this webcast. Thank
Right.
you very
Thank
much.
you. Thank you very much. Thank you.
subscribe now and press the bell icon. Never miss an update.